Okay.
I'm nervous.
Okay, we're live now, Councillor Hall.
Good afternoon and welcome to North Tyneside's Health and Wellbeing Board. My name is Councillor Margaret Hall. I'm Chair of the Board. This meeting is being streamed live on the Council's YouTube channel to enable members of the press and public to observe the meeting, and I welcome anyone who is watching. Before we move on to the agenda, I would first like to make it clear who is participating in the meeting and explain how we intend to conduct the meeting. In order to check who is in the meeting, I would like to ask everyone present to confirm their attendance at the meeting. In order to do this, I shall call out the names of the members of the board and others present. After I have called your name, please turn your microphone and camera on and introduce yourself so that we be sure you can be seen and heard. There's a lot of names, and I'll start. Councillor Muriel Green.
Good afternoon, I'm Councillor Muriel Green. I'm Vice Chair of this committee.
Councillor Matt Wilson.
Hello, Chair. Yes, I'm here.
Councillor Tommy Mulvenner.
Yes, Chair, I'm here.
Councillor Karen Clark.
Yes, Chair, thank you. I'm present. Long Benton Ward.
Hi. Wendy Burke.
Good afternoon, Chair. Wendy Burke, Director of Public Health.
Jackie Auld.
Jackie Auld, Director for Children's and Adults at North Tyneside Council.
Hello. Richard Scott.
Hi, good afternoon, Chair. I'm Richard Scott, GP in Whitley Bay and Clinical Chair of North Tyneside CCG.
Thank you. Leslie Young Murphy.
Yeah, thank you, Chair. Good afternoon, everybody. My name is Leslie Young Murphy. I'm the Exec Director, Nursing Chief Operating Officer, North Tyneside CCG.
Julia Charlton. Julia here?
I believe she is, Chair.
I'll move on and come back. Paul Jones.
Afternoon, everybody. Paul Jones, Director of Health Watch North Tyneside.
Michael Graham. Claire Riley.
Good afternoon. I'm Riley from Northumbria Healthcare. I'm the Executive Director of Communications and Corporate Affairs.
Chloe Mann.
Good afternoon, Chair. My name is Chloe Mann. I'm the Associate Director for our Access Services in Cumbria, Northumberland and Tyne and Wear Mental Health Trust.
Susanna Thompson.
Good afternoon, I'm Medical Director of Tyne Health GP Federation.
Craig Armstrong. Stephen Thomas.
Good afternoon, Chair. I'm Steve Thomas. I'm the Head of Prevention and Education for Tyne and Wear Fire and Rescue Service.
Thank you. Dawn McNally.
Good afternoon, everyone. Dawn McNally, Chief Executive of Age UK North Tyneside, representing older people.
Andy Watson. Cheryl Gavin. Dean Titterton.
Good afternoon, Chair. Dean Titterton, the Chief Executive of YMCA and also representing young people.
Thank you. Can I just go back over some names there that didn't reply, just in case they are present? Julia Charlton, Michael Graham, Craig Armstrong, Andy Watson, Cheryl Gavin. Thank you. I'll continue.
Yeah, Chair, I think, as you can see on the screen, Julia Charlton is with us, but Julia, unfortunately, we cannot hear you.
Right, okay, noted, thank you. We are also joined today by members of the Council's Adult Social Care, Health and Wellbeing Subcommittee, the Council's Overview and Scrutiny Committee with responsibilities for health-related matters. They have been invited to join today's meeting to consider with us the commissioning intentions. Councillor Trish Brady.
Councillor Brady, I'm here.
Thank you. Councillor Joanne Cassidy. No. Councillor Joe Kerwin.
Hello, Chair. Thank you. I'm here, and I'm Joe Kerwin, Councillor for Monksheaton North Ward and Vice Chair of the Adult Social Care and Health and Wellbeing Committee.
Yeah, Nigel Huscroft.
Hello, Chair. It's Councillor Nigel Huscroft, Northumberland Ward.
Thank you. Councillor Kath Davis.
Good afternoon, Chair. I'm Kath Davis, board member for the Preston Ward. Thank you.
Councillor Alan Percy. Councillor Paul Richardson.
Hello, good afternoon. Thank you, Chair. Yes, Paul Richardson, Monksheaton North Ward.
Thank you. I think I've missed the name of the chair of the Health and Scrutiny Committee. Karen, are you
Hello,
there?
hi, Margaret. Yes,
Right.
I'm here as a member of the board also, so very happy to be here. Thank you, Chair.
Thank you. Also present online with me are the following officers who are not members of the board but have joined the meeting to support and advise the board. I will invite them to introduce themselves. Officers, after I call your name, please turn on your microphone and camera and introduce yourself. Scott Woodhouse.
Good afternoon, Chair. Scott Woodhouse. I'm Commissioner Lead for Adults within the local authority.
Mark Taylor.
Good afternoon, Mark Taylor, Strategic Commissioning Manager for Children's and Family Services within the authority.
Kevin Allen.
Hello, I'm Kevin Allen. I'm Programme Manager at North Tyneside Council, and I'll be speaking on the Better Care Fund.
Joanne Holmes.
Chair, yeah, just to confirm, Joanne is with us, streaming the meeting live, but she's also the clerk to the Scrutiny Committee.
And yourself, Michael.
And Michael Robson, clerk to the Health and Wellbeing Board.
If I've not mentioned anyone who has joined the meeting, can you please now indicate either by clicking on the raised hand button or by switching on your camera and indicate that you're here? Got everyone, good. To ensure that the meeting runs smoothly, can I remind participants to please turn off your microphone and camera when not speaking. Only speak when invited to do so by me and activate your microphone and camera before speaking. If any member or officers wishes to speak, please use the hand raise button or alternatively the chat facility. And if necessary, I shall adjourn the meeting for a short period of time to allow any lost connections to be restored. I hope they're not mine. We shall now move on to deal with the business set out in the agenda. Item number 1, apologies for absence. Michael?
Yeah, we'll have apologies from Kedar Carley from the Cumbria Northumberland Tyne and Wear Trust. And as you've heard, Chloe Mann is here substituting for him.
Lovely, thank you. Are there any other apologies members have brought with them? No. Substitute members, we've heard of one. Michael's reported on Chloe Mann. Are there any other substitutes? Thank you. Any declarations of interest? Do any members of the board wish to declare any interest or conflict of interest in relation to the agenda on the items on the agenda? There being none, can I ask that we confirm the minutes of the meeting, of the last meeting, seems ages ago, 10th of December 2020?
Agreed. Agreed.
I shall take it that the minutes are confirmed. Thank you. We move now to the first item of the main agenda, the Better Care Fund, and I shall ask Kevin Allen to present to us the report in relation to the Better Care Fund, which is set out on pages 9 to 12 of the agenda. This is an annual event, isn't it, Keith? Thank you.
Yes. Thank you. Thank you, Chair. Just for those who might not have been members of the Health and Wellbeing Board last time we discussed the BCF, just give a brief overview that the BCF is a national government scheme which provides for a pooled fund between each clinical commissioning group and each local authority with responsibility for adult social care. And there's a series of guidance regulations normally published each year which set out a minimum value for the fund and in particular objectives that we're expected to focus on that year and what metrics we'll report on. Now, that hasn't happened in 2020-21, the reason being the COVID pandemic. So early on in this financial year, there's a message from the Department of Health, NHS England and the LGA, who are the bodies that shape the fund, saying basically you should continue what you're doing and not disrupt services with changes because that would make it more difficult to get through the pandemic. And that was firmed up and just shortly after the deadline. I think it was just shortly after or just before the last Health and Wellbeing Board, but too late to take it to the last Health and Wellbeing Board with an instruction saying, well, will you confirm that you've done this? And I'm looking at the national conditions on page 10. Will we confirm that we've met these conditions? So they are saying that we've pooled funds in a Section 75 agreement, which is what gives the legal authority for the two bodies to share funds. And the answer to that is yes, we have created a Section 75 agreement which has been signed. The next condition is that the contribution to social care from the CCG via the Better Care Fund is agreed and meets the minimum level. And I can confirm that the minimum expectations the CCG will contribute £11,096,000 to social care, and that requirement has been met with that exact amount. Then number 3, there's a category of expenditure called out of hospital services, which has to meet a minimum ring fence. And that minimum rate fence is around 4.9 million, and the actual amount on out of our services is 5.5 million, so that's been met. And lastly, that CCGs and local authorities confirm compliance with the above conditions to the Health and Wellbeing Boards, and that's really the purpose of this paper, to ask the Health and Wellbeing Board to note that we've continued to operate the BCF and it's in accordance with all the national regulations. Now, of course, we're not far off the next financial year, and that will bring with it a fresh round of Better Care Fund planning. And what we know so far is that the BCF will continue, and that's been reaffirmed in the NHS white paper that was published in the last few weeks. We know the level of the Improved Better Care Fund grant, which is one element of the grant. We know the level of the Disabled Facilities grant. The CCG contribution will increase by 5.3%. And we're expecting there to be new planning requirements published shortly. Although having said that, there has often been a delay during the course of the year in getting those agreed, and of course this year we have even more exceptional circumstances. So we would expect to come, well, we'll definitely could be coming back to the Health and Wellbeing Board at some point in 2021-22 to say that the Partnership Board, which manages this on a day-to-day basis, has considered whether the services have ongoing relevance, whether there's any new services, whether any services should be discontinued, and to seek the approval of the Health and Wellbeing Board for the current year, as it will be. But so this has been an exceptional year, and so what's happened is that we've continued with the services that were in operation, which are all really kind of part of our core services. They're not kind of optional add-ons or small projects. The PCF is, a core element of our services. So the board's asked to note the continued operation of the fund in line with national conditions, or alternatively request relevant officers in consultation with Chair and Deputy to undertake further work. I can't hear you, Chair.
Thank you, Kevin. The board is asked to note, as Kevin's just said, the continued operation of the Better Care Fund, and it complies with the national conditions set out in the report. Are there any questions or comments to Kevin on Mr. Allen on his report? I don't see any hands up. No hands up. Then thank you very much for your report, Kevin, and look forward to seeing you next year. Thank you.
There were two hands went up there, Chair.
Oh, sorry.
Councillor Green and Mulvanna.
I can't see. Oh, it's Muriel. Muriel?
It's on mute.
Unmute. Microphone.
There we are. Right, I'm here in full. On the where you're looking at the policy statement on the second page sets out the following national conditions. I'm presuming the references that you make to paragraph 9 and paragraph 10 are of the original documents that came along. It's a bit confusing to see refer to paragraph 9 and paragraph 10, and there are no paragraph 9.
Yeah,
right.
sorry about that. You're right. They are references to an NHS England document, and they just set out what those amounts are. So the following sentences in my report actually contain that information as to what the minimum amounts are.
Can I just ask how does this compare with sort of previous years in terms of a staggered improvement in investment? I'd like to see some sort of comparison of what we've had in previous years. I'm just wondering if there's anything you can say about that.
Yeah, so there were some reasonably large increases in the amounts which were set out, the minimum amounts. So it was around about 5%, which again we'll have next year. Yeah, those services have the amount of investment has increased in every year. And in this last year, it was around about 5%, and will be the same next year.
And can I just ask about there's an awful lot that we're going to have to sort of sort out with regard to the aftermath of the pandemic. But was there no indication in any of the paperwork that there was a recognition of perhaps a greater need to be spent on social care? Is there no clues or hints or suggestions of any improved changes that there might be towards tipping the balance in terms of extra funding for social care?
There isn't, unfortunately, and that's also true of the NHS white paper, which talks about integration of health and social care at a kind of what you might call a regional level of the integrated care system. But what it doesn't talk about is the whole funding mechanism, both in terms of how local authorities are funded and the to what extent residents contribute themselves towards the cost of social care. So those big issues are still not addressed in policy terms.
Thank you.
Right, grandson good. Is there anyone else?
I think Tommy Mulvena actually had his hand up as well.
Thank you. It doesn't indicate on my screen. Tommy.
Councillor Green has asked all the questions that I was going to ask. And I'm very annoyed about it because it was the first time I had really sensible questions.
Thank you, Tommy.
But having said that, if there's no one else wants to speak, I would like to move the report and the recommendation that it's noted.
Thank you. Is that agreed? Right.
Agreed, yes.
Right.
Yes.
Thank you. Thank you very much. Thank you, Kevin, and we'll move on now to the next item. We shall now move to item 6, to receive a presentation from the officers of the Council, the Clinical Commissioning Group and Health Watch in relation to the commissioning intentions of 21-22. I understand Wendy is going to begin the presentation, but I think it includes contributions from Mark Taylor, Scott Woodhouse, Leslie Young-Murphy and Paul Jones. A truly united effort. Thank you very much, Wendy, if you begin. And I know there's wonderful overheads, etc. Thank you.
Thank you, Chair. I'm going to share my screen and I'll control the presentation. If my colleagues can just indicate to me if I'm not quick enough changing the slide. But I'm going to cover the first couple of slides before I hand over very seamlessly. So thank you, Chair. Let me just share my screen first. Has that shared?
Not yet, Wendy.
Yes,
it is there now.
Yeah, now. Brilliant. Okay, let me just put it on from the beginning then. Okay, brilliant. Okay, so I am delighted with my colleagues to present this presentation. It's a joint presentation on North Tyneside's commissioning intentions. And of course, the presentation is to both the Health and Wellbeing Board, but also members of Adult Social Care Health and Wellbeing Subcommittee. So the commissioning intentions are shared annually with the Health and Wellbeing Board, and they are set for 21-22, so the forthcoming new financial year, and they very much reflect the joint strategic needs assessment, which underpins our joint health and wellbeing strategy. And just as a quick reminder, the strategic goals in that joint health and wellbeing strategy are to aim for measurable improvements to health and wellbeing in North Tyneside, reduce the difference in life expectancy and healthy life expectancy between the most and the least deprived areas of the borough, to focus on evidence-based prevention and early intervention, to engage and listen to communities, and to build resilience with whole system approaches, delivering better outcomes and value for money. So that's underpinned, as I've said, by the Joint Strategic Needs Assessment, and actually these commissioning intentions relate heavily to and also underpin what is in the Children and Young People's Plan, as well as the North Tyneside Place-Based Transformation Plan, which is our plan for health and social care across North Tyneside. All of that and all of those plans and these commissioning intentions ultimately contributes to the delivery of the wider plan for the borough, which we know as our North Tyneside plan. So our approach is to try and avoid duplications, which is why we don't do this presentation twice anymore. We do it as a one-off presentation to the board and to members of the scrutiny committee. We work together as commissioners from different organisations to demonstrate the synergy between those different strategic approaches, and of course we try to make it interesting. So just a little bit about governance structures, because there are lots of plans and lots of partnerships around, and for some people it appears quite complex. So basically what we've got is we have a whole strategic partnership in North Tyneside, which is known as the North Tyneside Strategic Partnership. It's chaired by the Mayor, and it has representation from every agency, from every walk of life across North Tyneside, including health and social care, but a range of other partners as well. And that is the partnership that oversees the wide, broad-based plan, our North Tyneside plan for the borough of North Tyneside. Now, feeding into that are a number of other strategic partnerships, and we've got the Children and Young People's Partnership with its plan. We have obviously the Health and Wellbeing Board with the Joint Strategic Needs Assessment and the Joint Health and Wellbeing Strategy, and then we have Safer Communities with the Community Safety Plan, and of course they all contribute to our North Tyneside plan. Now, in addition to that, we have the place-based transformation plan for health and social care, which is overseen by the Future Care Executive and the Future Care Programme Board. And again, that has close alignment with the Children and Young People's Plan, and it feeds up into the Health and Wellbeing Board. And all of that culminates in an overarching plan for the borough. So I hope that makes sense. And then this is a very busy slide, but it gives you a bit of a description of just how the Future Care Board arrangements and that place-based transformation plan, how those arrangements come together. And you can see it's complex because actually health and social care is very complex. And I think it just this slide basically gives you an overview of the different strands of work that fall within the Future Care Programme Board that contribute to the overall plan. And I hope that you'll see from this presentation that some of the commission and in fact a lot of the commission and intentions underlie some of those programmes that are part of the Future Care Programme Board and the plan itself. So I'm going to pause there. We now have the commission and intentions. We've divvied them up into a number of sections. So we're first of all going to have a look at the commission and intentions that particularly pertain to children and young people. And I'm going to ask Mark Taylor to take us through those. Mark will then hand over to Scott Woodhouse, who will take us through the commissioning intentions for working age adults. And then we'll go to Leslie Young Murphy, who will pick up older people. And then I'll say something at the end about some of the priorities around COVID-19 and the pandemic. So without further ado, Mark, thank you. Over to you.
Thank you very much, Wendy. I'm delighted to be able to present the priorities for children and young people, the commissioning intentions. If you could move the slide on, please. Thank you. And I'd like to start with the Children and Young People's Plan. You'll recall from the Health and Wellbeing Board meeting in December, I took you through the draft children's plan, and I'm hoping you'll recall the vision statement that we shared with you, and importantly, what we call our 5 I's. So these are the things, the outcomes that we know are really important for children, young people and their families and carers. So the 5 I's being I am safe, I am healthy, I have opportunities, I have a voice, and I am happy. So that's the overarching framework within which our commissioning intentions are established. Thank you, Wendy. So I have 2 slides with a range of different commissioning intentions. And I think you'll appreciate that each of these particular bullet points has a raft of different programme elements and priorities within them, and probably merit a presentation in their own right. But I'll take you through the headlines and give you an oversight and overview of the key priorities. So starting really with maternity services, commissioning lead from the CCG in terms of the NHS long-term plan and the Better Birth Expectations, which is the National Maternity Review. So a range of priorities within that particular area includes a raft of different things, including we've listed there a number of those different initiatives, and also perinatal mental health and other priorities all linked to maternity. That's the first key area. Building on that, our 0 to 19 children's public health services, we have our health visiting service element, and the health visiting teams providing a raft of support and to families in terms of 0 to 5. And we've got some particular priorities within this around ensuring we have developed a breastfeeding strategy, and we've also highlighted here some other work around an ongoing pilot of smoking in pregnancy. We're very keen to evaluate that pilot with Northumberland, with Northumbria, and ensure that we've undertaken that evaluation and considered our options for commissioning that service. So that's on the 0 to 5 element. Obviously on the 5 to 19 element, which includes our school nursing services, there's a whole raft of other areas that we will be working on for that as part of the 0 to 19 services in public health. Third point to highlight, third intention, again around early years, but particularly around early years education and childcare. Within North Tyneside, we have across schools, nurseries, both private and independent, childminders and other providers, about 200 childcare providers, all following the Ofsted Early Years Foundation framework. Critically important, again, working with our health visiting teams and others to ensure we get that best start in life, and all of those services working together, both to support the child and to support families as well in terms of their childcare needs. Much as you'd expect, a huge amount of impact as a result of COVID in terms of parental support for parental need for childcare. Nurseries and childcare have remained open throughout the pandemic, and it's a case of us ensuring that we can support that childcare sector and the early years provision, and ensure that remains a strong and robust market and network of providers for us in North Tyneside. The final bullet on this slide, this is a long-standing priority for us and an area that we continue to put a huge amount of emphasis and focus on, which is around children and young people's mental health and emotional well-being. We've always made the point that this is about a whole system approach. It's not purely around clinical services or CAM services. This is about the whole system, and we've had the opportunity as the only authority in England, along with one in Northern Ireland and one in Scotland, that is part of a strategic alliance with Barnardo's. It gives us a longer term approach to really focus on a number of areas of prevention, early intervention and other innovations to support children and young people's mental health and well-being. A number of those are listed there. We're piloting a specialist sleep service and some further training there following a needs assessment that we've done. We are looking at a whole raft of work within schools. Again, it's well documented and certainly highlighted the impact of children coming back to school, the impact of periods of being absent due to lockdowns and periods self-isolating. Getting kids back into schools is absolutely key, and the emotional health and well-being of the children, being able to support schools and support services and systems around schools is really important. On the next slide, again, following that theme, where we have particular priority groups, special educational needs and disabilities, for children and young people up to 25, we need to make sure we do everything we can, and we've got a new inclusion strategy which says, can we ensure that we have as many children and young people supported in their mainstream schools, that we get all of the health and care as well as education working to reinforce all of that support, and as many children within the excellent schools of North Tyneside supported there, and again with reference not just education but some of our work around short breaks. The second bullet point here reflects next is paediatric care. The paediatric care work I know is something that the CCG's led on, working with Northumberland CCG together and Northumbria, and I understand that the pathway development is well underway, and much of that requirement is being developed and is working effectively. Third point here, young carers. We have a number of duties to identify and provide a young carer's needs assessment for those young people, and to provide the levels of support. And we certainly do commission support linked to the Carers Centre. We've got 413 registered young carers at the moment, and there's some opportunities to further strengthen the work we do to make sure all services are working collaboratively and collectively to support our young carers. The next point, this was on the list of priorities for last year's commissioning intentions. We have an integrated sexual health service, and we will be, as we approach the end of the current contract term, we're looking at re-procuring that service, again taking account of the experience and some of the different ways that residents and others are accessing those services as a result of COVID. So there's something that we'll be looking to re-procure around the sexual health services. As I've moved to the end of this slide, domestic abuse services, you'll know that there's a new Domestic Abuse Support Act and a whole lot of new statutory duties and some opportunities to work further on building on what are already some well-established services we have in North Tyneside around accommodation and support, both for victims of domestic abuse, also some work to support young people and children who have been a victim of and have experienced domestic abuse within the family. So there's therapeutic work and other work around the domestic abuse services. And the final point on this slide, it's been a key priority, again reflecting COVID pandemic and the impact on the borough and some of our communities and families within the borough, to ensure that our approach to tackling inequality and poverty has an integrated approach. Certainly we have our established poverty intervention fund in North Tyneside, and we also have a new programme which is about supporting children, young people with a holiday activities fund, school-aged children who are eligible for free school meals, and how to ensure we get the right level of enriching and engagement activities, along with programmes to tackle holiday hunger, ensure we have a holiday activities fund that runs through the Easter, summer and Christmas holidays this year. So appreciate a whistle-stop tour of a number of our key children and young people's commissioning intentions. I'll take a breath and pause there. Thank you.
Thanks, Mark. Thanks, Wendy. Scott Woodhouse here. I'm going to cover the working age adults commissioning intentions. So we've looked at this from the point of view of outcome-based commissioning arrangements, and similar to what Mark described in children's services, thinking about the person at the centre and their particular individual needs, and also the outcomes that are really important to them. So similar I statements around I am healthy, I am safe, I have a voice, I am happy, and I have opportunities. What we've then done is looked at that then from the point of view of service delivery and service provision. So when we look at individual services, when we look at the quality monitoring arrangements and CQC monitoring and regulation for those registered services, we're looking at each of them in relation to, are the services well led, are they safe, are they effective, are they caring, and are they responsive? And that gives us an indication in relation to those component aspects. And then the final outer layer of the circle is in relation to the commissioning for better care outcomes framework, and that sets out a number of arrangements in relation to the market and provision of services that are commissioned or are delivered in North Tyneside, and that covers aspects such as quality, leadership, etc. So when we look at the specific intentions for working age adults, the first two are public health related intentions, and looking at the current smoking service and the fresh and balanced service to review the service and put in place a new specialist stop smoking service with the Community Pharmacy Federation. Clearly, we want to support people's independence and maximise that and support people to be independent for as long as possible. And that includes continued support for carers and wider carer groups, but also thinking about how we develop and put in place enhanced assistive technology to complement paid provision or to support people to remain independent and delay any need for other commissioned services. From a supported accommodation point of view, we've got a couple of procurement exercises coming up this year for services that are coming, existing services that are coming to an end for under and over 25 homelessness services. These, as I say, are due to come to an end, and we're looking to review that provision, look at how it's delivered, and then go to the market for 2 new contracts from later this year. Within primary care, supporting the primary care networks to make best use of additional funding that's gone in to support them, thinking about the multidisciplinary team approach to how that's delivered, but also how it links in with the NHS long-term plan, with regards to access to primary care services, and then how social prescribing can complement that and support people for a period of time once they've been in touch with primary care services, again with an intention to prevent follow-up service provision, so it's a short-term intervention programme. Community health care, looking at that current provision and across North Tyneside, and looking at how look at integration of those services where possible, and looking at that with the current framework of provider networks and services that are out there, including the community and voluntary sector as part of that work. And then finally on this slide, looking at pulling together an autism strategy and pathway to support people. This has been delayed because of COVID, but we're picking this work back up and progressing that in the next financial year. And we know from government, from DHSC, that they're about to publish a new national update to the autism strategy. So we will make sure that it is consistent with that strategy going forward. Transforming care, we've talked about this for a number of years, which is around people with a learning disability and challenging behaviours and autism coming out of hospital and reducing those long stay cases, but it's also for us about preventing admission in the first place. So part of that work is to ensure that there's sufficient care, support and housing provision across North Tyneside to support those people to come out of hospital and to remain independent, and make sure that there's a good network of support around them from a health and social care perspective. The structured diabetes programme, looking to pilot that in the next year, especially around people who have type 2 diabetes and a learning disability. And we know from wider information that people with a learning disability have higher levels of health inequality, so it's really important that there is a focus there, particularly around diabetes for people with a learning disability. In relation to drug and alcohol, there's some additional funding coming in to support those groups of people, especially hard to reach groups, and we're busy looking at that and working with the teams and with the CCG to look at how that might be identified and allocated, and particularly around those people who aren't accessing support, and thinking about maybe an assertive outreach model to support those people as part of a pathway out of provision. the national mental health strategy, looking at how that's set out and then how we make it localised to North Tyneside, and thinking about the community mental health provision that we've got in place across health and social care to support those people with serious mental illness, and just looking to make sure that that provision is appropriate, that there's no elements of duplication and gaps within that service. Forensic services and pathways, that's looking at a review of current pathways that we've got for people coming out of hospital, particularly, and that links into the transforming care agenda, where we know that we've got a number of people in the transforming care cohort that do have a forensic background and are supported through specialised commissioning within NHS England. So this is about looking at that arrangement for those people coming out, making sure that we've got sufficient provision, and that where we can review and free up some provision that we do that, but also looking at out of area placements and people that we support wider than just North Tyneside to see how we can support them better going forward. And then finally, in relation to psychological pathway review, that's looking at the review of that pathway across mental health and psychology services, how that interacts with the community treatment teams, the mental health teams, and any specialist psychological therapy services that we've got in place through external provision, and taking that holistic review and view of those services, that delivery, to evidence impact, identify any gaps that are in place and any possible duplication. Thank you.
Hi, I'm Leslie Young Murphy. I'm going to pick up on the older people. Thanks, Wendy. So as you can see here, this is our approach for supporting our population to age well. The key aim of this is to make sure that we support people to live longer, but live longer in good health. As you can see, we have 3 principles in terms of our Age and Well strategy, which was a co-produced strategy with all of our stakeholders, all of the partners, but informed by reference groups of carers and the public. So the 3 key areas are around maintaining health, so staying healthy, staying active and staying connected. Delivered through making sure that we have an integrated approach to delivering health and social care services, and we've worked for a number of years in terms of how we can optimise services and reduce gaps in service provision by having a more holistic approach to delivering multidisciplinary teams. Integrated digital systems, and increasingly in our sort of technological state, we've got a number of systems and they don't always talk to each other. I think we've made good strides in North Tyneside, but also regionally in terms of how that happens. But we just need to make sure that we don't forget about our wider partners when we're looking at how we innovate across and share information across systems. We need to have an integrated approach to having a workforce who can respond to meet the needs of an older population, and therefore our approach to workforce development is really important. We've already got an integrated approach to contracting and commissioning, and I think over the years that's worked well. We've got a number of mechanisms to have shared monitoring in place, including from a public health point of view, through Future Care Programme Board, and also through the through the Health and Wellbeing Board. All of our service approaches are person-centred. We premise that on shared decision making, so making sure that people have got the right information to make the right decision for them at that point in their lives. And also one of the areas that we've discussed at length is around realistic medicine, and making sure that people understand that just because you can intervene doesn't mean to say that you should. So it's making sure they've got the right evidence to make that decision. Equally important is that we focus on what matters to the individual. And sometimes I think, you know, all of our services focus on that, but I think sometimes when we're drawing up care plans, we don't always put what matters to the individual first and foremost. So it's a real hard push to make sure that we all do that in a consistent way, regardless of which organisation's involved. The other areas around a co-production commitment to make sure that in all of our changes we involve local people, and that carers, particularly for older people, are centre stage to make sure that the services that we do develop together are fit for the future. You can see the areas in terms of safe. I think they speak for themselves, but also making sure that our services are inclusive and make sure that we consistently make reasonable adjustments to make sure that our services are accessible and to make sure that we've got no wrong door, that referrals may be redirected, but they're not rejected. Thanks, Wendy. So these are our commissioning intentions. We want to support people to be active. We've got a range of initiatives across a range of strategies and organisations. So want people to remain active, eat well, stop smoking and reduce alcohol intake. We've got a range of initiatives, but these are just a couple of highlights. As you know, during COVID, we did North Tyneside and actually Newcastle and Gateshead leaflet drop on the How Fit campaign. That was the start of the campaign to try and get people more active. We know particularly for the older people that core strength, is really important in terms of support and balance, which reduces falls. So it's a real targeted approach to how we deliver that. And there's a number of areas that we're working on in relation to the How Fit campaign, which also ties in with the development of the Goal Seeker app. And that is around an app that we're co-producing with a number of stakeholders, including local people, to gain rapid access in terms of their own care plans, but also that they themselves can monitor progress in terms of how the goals that they've set for themselves. And at the same time, they can receive support and advice from a range of different professionals, depending on what the health needs are. We've got to target and put in place our new contracts and arrangements for our extra care services. We'll be working with providers to develop a market and look at extra care provision across the borough, including dementia-specific services. And as part of that, we'll be making sure that we use best practice and look at evidence-based practice across the United Kingdom to do that. We've got to focus on reviewing the day service provision requirement and make sure that those requirements feed into the new contracts and services. Clearly, COVID's had a huge impact in terms of that, and I know Wendy will pick up in terms of the COVID and COVID recovery. As ever, residential and nursing homes are a key premise in terms of our commissioning intentions. We will be looking at reviewing the demand and requirements for home care provision, particularly this year, looking at the sort of commercial arrangements, looking at the market state, which has continued to happen throughout COVID, and they'll feed into the procurement exercise. We'll continue with our improvement offer in terms of the improving IT infrastructure. It's something we started a long time ago, and we're working with a couple of providers to do that. There's a range of how various homes access internet, which means that they can't always use some of the technology that would be available to support them, but also providers who are going in can't actually use the kit that they're using, as well as for education and support for residents. So that's a really early important win. We are continuing to embed the use of NEWS, which is a nurse and early warning score. We deployed 2 years ago now the kit, which has got blood pressure, temperature, and pulse oximeter, which is measuring people's oxygen. And actually, it's proved invaluable during COVID. But this is one area that we need to continue to work on in terms of education. It supports the homes to early identify a deteriorating resident. which means they can have more meaningful conversations with the aligned professionals who support the homes and make sure they get early intervention as required. We've deployed a number of things over the years, and one of the most exciting things I think this year, after a number of years, we've finally managed to secure some funding to put in some advanced care practitioners, which will train over 3 years into nursing homes. So they'll be employed by the homes themselves, and we're currently working with the homes in relation to that. We continue to, you can go on the next slide, Wendy, please. We continue to work with partners in terms of developing our integrated approach to frailty. So our Age and Well Hub, together with our bed-based rehabilitation, is a key focus this year. We've got a lot of good services in place. We've made some step change, but clearly with COVID, we just need to renew that emphasis to bring them all under one banner. For the benefit of the public. We're also planning to integrate the community falls service as part of a phase 3. We continue to work with partners to ensure that we've got the right capacity across primary and community care, particularly in terms of being able to provide that urgent response to prevent unnecessary hospital admissions. And that's really important. The last thing we want is elderly people to have to go into acute care when actually they could be dealt with really well in the community. So we're working with our teams across the system to make sure that we've got the right response in place. We also, the same applies to people who've been in hospital. The key question before somebody leaves is home first. Why can't they go home first? We need to maximise the opportunity that rehabilitation can afford. We've got some really good evidence in terms of what works in North Tyneside. We've got a proven track record in terms of discharge to assess, and we really need to focus more in terms of getting more people home and reducing the number of patients, a number of people rather, who are leaving hospital, who go directly into care homes, unless of course they're returning residents or it's quite evident that that is the only option from a safety point of view. We're working this year to focus on older people's mental health crisis services and that rapid response. And also in terms of the cancer services, making sure that we continue to work with the North East Cancer Alliance in terms of implementing rapid diagnostic centres that will improve access to cancer testing for the residents, and also reviewing the pilot that was in Wallsend in terms of early lung cancer, with a view to rolling out across North Tyneside. And finally, palliative care. We've got some really good services in terms of palliative care. We've made some great strides in terms of our nursing homes and people dying in their place of choice. But this year, we're going to focus on how we can bring some of those services together to maximise the opportunities that will bring and deliver against the end of life strategy, which was a collaborative initiative across all of our stakeholders. Thanks, Wendy.
Thank you. Thanks, Leslie. Okay, is that presentation still showing? Sorry, I'm really confused because I've got 2 screens. Is it still?
Yes,
it is.
It is, yes.
Okay,
It is, yes.
I'll keep going. Okay, hopefully, has that moved it on?
Not yet.
I'm really sorry about this, but okay, let me have another go. Has that worked or not?
Not yet, Wendy.
No. I'm going to stop sharing and I'll share again and see if it makes any difference. Bear with me. Is that helping now?
Hasn't moved on, Wendy. It seemed that's it. It's moved on.
Excellent. Sorry about that. Technical glitch. Okay, so I'm just going to cover a couple of slides on the COVID-19 pandemic. I think it's really clear from what Leslie Scott and both Mark have said that the COVID-19 pandemic over the last year has had a significant impact on what we've been doing in North Tyneside across the board, but more particularly from a health and social care perspective. And we know that the journey to recover from that pandemic and to move to business as usual, even though the virus is potentially going to be endemic in the population, that will be an important part of all of our plans. So one of the things that we're doing at the minute and will be ongoing from the period from April to September is a review of the COVID-19 outbreak control plan. So the plan will be fundamental in helping to achieve the government's roadmap, and particularly the lifting of the restrictions and allowing us to live safely with COVID. And a key part of that plan will be around further developing a local model of test and trace, making sure that we are able to provide testing for people who might have symptoms or who are asymptomatic, and then tracing their contacts and making sure that those people who need to self-isolate are given the support to do so. So, you know, the principles of outbreak control, even though we're going to have significant levels of immunity with our vaccination programme, we are likely to still have some pockets where we have local outbreaks and we're going to need to respond to those. So part of the work we're doing will be to continue to work with VODA on their Community Champions programme. That's going to be extended up until the end of September, particularly again focused on ensuring that the public health measures to prevent infection are in place across our communities, but more particularly to make sure that we've got really high uptake of the vaccination and also equity of uptake of that vaccination, because it's that will really prevent the outbreaks of infection happening. We'll continue to have a focus on the high risk settings, particularly our care homes and schools and workplaces, as some of those restrictions lift. And as I've said, in terms of the vaccination rollout, what an effort. I think there's not anybody on the meeting today that wouldn't agree what a fantastic job the system is doing in terms of providing the vaccination programme rollout. And I think, you know, making sure that we align with the national timescales and make sure that we've got that really good uptake right across the board, as well as making sure that we address the inequalities and we don't have big pockets of the community and large groups that are not vaccinated and are not protected, because we know the vaccination is the best protection that we can offer to our population. Long COVID rehab remains important, so we know there's a significant number of people who are suffering with long COVID, and providing rehabilitation services to manage those long-term effects is really important, not only from a physical health point of view, but also a mental health point of view as well. Pulse oximetry at home, again, helping to detect silent hypoxia, so reducing mortality and morbidity, again, as a result of contracting COVID-19 virus. And again, as we've said, continuing support for care homes and making sure those measures are in place to support safe visiting in those homes. We will be doing a lot of work across the borough in terms of just understanding what the impact of COVID's had on the already existing inequalities that were there pre-COVID. And I think that's really important. That will underpin a lot of the future work to come, and it will also underpin some of our plans as we move forward. But and you know, those plans will include understanding the impact on carers, understanding the impact on certain populations and groups. In terms of the voluntary sector, again, agree continued use of the CCG grants to the voluntary sector organisations, because we know that's a fantastic way to provide innovative solutions to meet needs as we go through the next period. We know that for some parts of our population that digital exclusion is an issue, and certainly one of the things we've learned over the pandemic is that a digital solution has been for many people has enabled them to go about and, you know, be able to go to work, to be able to have the information at their fingertips, but not everybody has access to digital technology. So really important that we work out just how digital exclusion can be reduced or eliminated. And as I've said, there's a whole journey for both recovery and I guess restoration, and continuing to live with the virus safely, really for the foreseeable future. So I'm going to pause there, and I'm now going to hand over to Paul, who's going to talk to us a bit about what I talked about earlier on in terms of our strategic goals. One of our strategic goals is about engaging and listening to communities. And Paul, from a Health Watch perspective, is going to tell us a bit about what has been picked up from our local people and our local communities of late. Thank you, Paul.
Thank you, Wendy. And thank you very much, everybody, for the opportunity. I think what I'm going to try and cover is some of the key themes and issues that we've been hearing about, both from us directly at Health Watch and working with partner organisations in the voluntary community sector, and to other means as well, so that we try to kind of gather feedback from people as much as we can, and then feed that back into the system, into the decision making around the commissioning intentions, and directly to services on a kind of week in, week out basis when we spot issues that are emerging. So some of the key themes that we've identified, and this will be very familiar to people at the Future Care Board because we've talked about these quite a bit, is access to information. And I think over the last 12 months, particularly in the early days of the pandemic, there was a real need for a place that is a one-stop trusted source of information about all sorts of different services across the borough. There was lots of things happening and changing quite quickly, and I think we recognise, looking back, and part of the reflection exercise that's been going on so far, that we could have done things a little bit better in terms of that, and that's been a big kick. That's been a big push behind the kind of the work that's going on at the moment around the Living Well North Tyneside platform, which is a partnership that involves the CCG, the council, Tyne Health, the GP Federation, voluntary sector organisations, and ourselves. That's coming together to kind of really work up a much better way to kind of ensure that information about what's going on in the community, what kind of services are available, what support's available to them, how they can get involved, is available through this new platform and the new partnership that's coming on stream. We're hoping that new website will be launched in June this year and replace the kind of current Sign website that's there at the moment. So that's a really exciting and useful, I think, and hopefully useful piece of work that's going on at the moment, which will have real tangible benefits to the local communities and local people who've said that they struggle to access that high quality information that they need easily. One of the other things that's being touched on through the commissioning intentions discussions is around access to care. And it does link to the digital inclusion point. We've seen during the pandemic, we've seen a huge shift away from face-to-face activity and much more kind of work that's being done virtually, either through telephones or through online means. And obviously face-to-face work has continued and that has been very much appreciated, but there's that significant shift that's happened to that more remote working. And what we're doing at the moment is continue to gather people's feedback about that, and working very closely with the CCG and the primary care networks to gather people's feedback about kind of what's worked well and what could be improved for the future, and what people want to see in terms of this, the kind of the more virtual and more remote access, because there has been some real benefits for some people, and it's provided greater access for some. However, there are some issues that we kind of need to be aware of, and particularly linking to the kind of digital inclusion point, where people who haven't got the confidence or the skills or the knowledge to use online services, they might not have the kit, or they might not have the finances in terms of being able to afford Wi-Fi or credit or data to be able to access these services that are kind of increasingly delivered online. So that digital inclusion point is a critical one, and something that the CCG are putting some funding behind to investigate further through a significant research project as well. Transport continues to be an issue. You wouldn't be expect to hear from me without me raising the transport issue. I think slightly it's a different issue because obviously there's been fewer people travelling to kind of hospital appointments and things like that. But it does continue to emerge the challenges around people getting access to hospital appointments, but also to general the services in the communities as well, dentists or the GPs or what have you. So that's a piece of work that we kind of ongoing conversations with partners about some of the potential solutions around some of that. Something that's really emerged during the pandemic is around communication and the coordination, and I think it's based upon people's if somebody's been in a care setting, so in a hospital or a care home, and where the visiting has been restricted because of the pandemic, then we kind of seeing a trend where the communication hasn't always been great with the families and the carers and the loved one about what's going on with the loved ones. What tests they've been having, what's happening to them next, and that kind of people taken along the journey of care with their loved ones, which you would tend to get if you were visiting them regularly in a caring in a setting. So there's something that's really interesting about thinking about how we can work on that kind of communication and coordination better, so that even when and hopefully, you know, with the vaccine rollout, things will change and visiting will be resumed as it is being in care homes at the moment. But getting that communication piece better so that families can be kept better informed. And we've been doing some work directly with some of the members of the Health and Wellbeing Board to provide direct feedback and to look at different mechanisms and different approaches that they could take, recognising how difficult it is with busy staff teams under a lot of pressure at the moment. And I think Wendy pointed to an interesting piece about inequality and equalities. We're starting to see in the feedback and the work that we're doing, particularly around maternity services, but also to some in some ways some of the access to vaccine stuff, about the kind of interesting points about if people have transport or if people can afford to pay for additional support when other things haven't been available, then they'd be taking up more of that option than they probably would have done, than certainly they say they would have done in other ways. So I think there's some further work to be done for us, and we're doing some work on this at the moment to identify some of those inequality points that are kind of in there. Could you flip it? Thank you, Wendy. So what we're gathering lots of feedback on at the moment is the issues that are on the slide there, actually. The vaccinations is obviously a very hot topic of discussion, and the feedback that we're getting from people who've had a vaccination has been incredibly positive, remarkably positive, and a true testament to the kind of excellent work that the volunteers and the providers and everybody's done to kind of get that working and working well. And we're starting to pick up some niggles at the moment, and some quite significant niggles about access to vaccines. So people who've been invited to book into appointments, particularly through the national scheme, but the slots, the appointments are not available. And we've been feeding that back into the CCG and the primary care networks and nationally as well. And some of the findings that we've had through some recent work, and which I think is going to be discussed with the vaccine board in due course. We've been doing some work around pharmacy and medications, as well as maternity and child health, and waiting for treatment as well. And those pieces of work are ongoing at the moment. We're gathering people's views and feedback, and working on the kind of actions and recommendations that we'd want to feed back into the providers and commissioners at the moment, and I'm sure we'll talk about them at a future Health and Wellbeing Board meeting. Carers is, as you will be aware, we at HealthWorks have a really good, strong relationship with the Carers Centre, Age UK, and others who work and support with carers. And I think we've been gathering quite a lot of experiences during the pandemic about the increased pressure that people have felt, the increased desire to to internalise for carers to take on additional responsibilities to support their family members rather than kind of reaching out to kind of public services. Part of that being around fear of kind of risk and kind of catching the virus as well. But we know that that's raising risks of fatigue, and I know that we've been talking a lot with the adult social care team about what that kind of looks like, along with the carer centre as well. And I think a big piece of work that has gone on recently, which relates to the vaccination programme, has been an amazing piece of work that the carer centre have led to kind of work with the primary care networks to get to identify carers who weren't known within the system, within any of the systems, to come forward to register for their vaccination. And with the carer centre doing that piece of work, they are then also offering them support with their caring role, connecting them with the services that will help them in their with their caring responsibilities. So that's been using the kind of vaccination as a way in to identify a population that we knew were not being reached by services as they stood. With care homes, obviously this week has seen the start of visiting in many of the kind of care homes, which has been massively welcomed by family members, and we're continuing to kind of hear from families and friends about their experiences, and that desire for communications and clear communications, ongoing communications, and the real sort of drive to and hope for further visits and opening up in due course, because that's been a very, very difficult situation for people during this period of time, obviously. And I think mental health, I think we are obviously aware of the challenges that COVID has brought, the increased anxiety, isolation, sense of loss of control, and working with the services to look at how services could be structured in the future, what the needs are, but also to do our own pieces of work about kind of what services are available in the community, and put some key messages out there about how people can kind of look after and support themselves, as well as where they can get help and support from the formal kind of public NHS services from. And there's a piece of work that's just been started that's been coordinated by Felicity Shoesmith at the council around bereavement support, which I think we've recognised that actually there are some gaps there. There have been a lot of people who've been touched by bereavement in the last year or so. We haven't been able to kind of have the traditional ways of marking somebody's passing that are kind of that are really important to us as a community. And so we think there is a kind of a lot of issues around bereavement support there that have been kind of banked up at the moment in that kind of way. So that's kind of just a very brief whistle-stop kind of coverage of the kind of key issues that we're kind of working on at the moment. Thank you very much.
Thanks, Paul. Chair, that concludes the presentation. Thank you very much.
Can I thank you all for an excellent presentation, very clear slides, and I certainly feel as if I understand more the future care plans in North Tyneside. Now, can I invite members to ask any questions or make any comments? Right, Muriel, I see you have indicated. Hello.
Right, thank you. I echo your words, Margaret, about the excellence of the presentation. It always gives me a sort of feeling of warmth, of almost wraparound care that we're going to get, joined up services from all of the health and council services that will focus on the individual. And I think that's a really good feeling for me. There's one slide that I wanted to actually question, actually. There's loads of things in there, and I know that you haven't put them into sort of priority lists. They're all equal priority. But I wondered if Mark's, the education one, the last slide had two items at the bottom. One was about tackling domestic abuse, and the other was inequalities and poverty. And it just struck me that I mean, I know we've got the Poverty Intervention Fund, which is temporary at the moment, I would have thought, and I've been on the Child Poverty regional group for some time. But 40 years ago, we had a report which told us that there were huge inequalities within this borough. And here we are 40 years on, we're actually in a worse situation with regard to inequalities. Now, I just wonder what it is that you have, Mark, that you think might be going to be done differently or improved upon or changed in any way that would reduce those inequalities, because it comes up year after year after year, and really it's the one basic thing. I have to say, and I've said this openly and to me, I find a society which is fifth richest in the world that has to make people rely on food banks is frankly just not acceptable, and that's where the inequalities come. I know a lot of it will be about national decisions and national recommendations, but is there anything locally, Mark, which you say within the school population you would try to solve or tackle some of those inequalities or poverty within the children's plan, children's group, please?
Thank you, Councillor Green. Yes, if I can respond to that. I seem to recall we had a similar conversation at Health and Wellbeing Board last year following the commissioning intentions. And as you say, this is one of those kind of long-standing things. And clearly, the reality is, I think, for many areas, inequalities and the gap between, particularly I'm thinking about education as an obvious one, the danger is that any gap will be exacerbated by the pandemic. And what we're clearly trying to do is ensure that we get everything right as a whole system. I've not been able to get into a lot of detail here, but we have agreed, for example, around schools, an education ambition strategy for North Tyneside. And that's about all children and all schools and all learning and training provision. But there are so many mutually reinforcing things we need to do within that. Yes, we need to focus on some of the support for children and their families and communities around any additional support. So that one example around trying to tackle a lack of holiday activities or holiday hunger, the Holiday Activities Fund is about, I mean, it's one programme amongst many, but I think it's only one small element. I think we've got to look at a whole raft of more strategic interventions, and it's long term, and it's trying to ensure we can help children re-engage and catch up. And then we have all of those opportunities around not just attainment in school, but all those pathways through into further learning, to training, employability, and certainly just focus on that one education ambition strategy that tries to do a bit of all of that. Really, we need the whole system working together. We do need to support our vulnerable groups. We do need to get the right level of catch-up support. We do need the right level of mental health and emotional well-being support in school, and they are some of the biggest things that certainly I and others spend a lot of time on. I've not really had the opportunity to talk to you in as much detail as I'd like about the mental health work. You know, we're looking to get every school to take a real focus around getting all of their staff, all school to be a kind of emotionally healthy school, for staff to be trained in mental health first aid. And there were a raft of different initiatives, and unfortunately in the time today we haven't got the opportunity to kind of unpack all of those things. But as ever, I agree with the core point that there's always been levels of inequality, and unfortunately we're tackling a pandemic that has, as I say, exacerbated that. So as long as we get our ambition, our strategy right, it's whether we can resource and support and deliver on all of those aspects. And there's a multitude of individual programs which we're trying to put together into a strategic whole to try and address some of that. But yeah, it's a challenge for all of us, and I think the best thing I can say is certainly working on the children's plan, and obviously understanding the links across children's services, adult services, and the wider work of our governance structure. The vision and the commitment is certainly there from partners. It's not something the authority can do on its own or individual schools can do. That wider kind of coherence and support is something which gives me hope that at least we can be working collaboratively to try and make that difference. But at the moment, we're almost focused. It's managing the short term and the longer term, isn't it? It's the immediate recovery, which we're quite focused on. It's the schools just coming back. It's the testing in schools. It's the catch up, how children are, got on with blended learning and things like that. And then also having an eye to the medium term and longer term strategic direction and making sure that we're not just focused on the immediate, but the longer term recovery and some of those foundations moving forward. There's no easy answer. There's probably a raft of different things, and it's probably that's probably enough of an answer for now.
Margaret, could I just come in there, because I think Muriel, I think you're absolutely right to raise it. I think for me there's something about the big structural issues that actually need to be tackled by government, and I think we all accept that, a fair taxation system that doesn't impact on the poorest in society would be a really great place to start, as well as a decent standard of living if and when you're on benefits. But we'll not get into the politics of that. I think everything that the local authority and the system as a whole is doing is focused around trying to address those inequalities, and I think Mark's right. It is about educational outcomes. It's about reducing the gap. It is about training and skills. It's about decent paid jobs. And actually, there's a lot we can do as a local authority, particularly within the combined authority, to support local businesses, to create jobs, to find the skills, to get people into those jobs and a decent standard of pay. I think there's something about decent homes. I think all the work that the local authority is doing around decent homes, so that families aren't spending over and above what they need to on heating costs, because that puts a lot of families into poverty. So I think there's a whole raft of things that we're doing to try and tackle poverty as well as alleviate it. But I think the two agendas are slightly different. So there's a whole preventative agenda of those wider determinants, as well as some of the things that we can do to help families who are in poverty in the here and now, such as the work that the Mayor and Cabinet have led around poverty alleviation, which is really important.
I know the will is there. It's the practicalities of getting it done.
Thank you very much.
Yeah.
Can I ask, I still have the last page of the presentation up on my screen. Is it possible to take that down so that we have a usual format? Thank you.
Sorry, Chair.
So, no, it's quite all right. I saw an indication to ask a question from Matt Wilson and Tommy Mulvenna. Can I ask Matt if he still wishes to have a question, if you would like to come in now? Matt?
Yes, thank you, Chair. I've been umming and ahhing, and I think it's probably a bit obscure and it will take us off topic, so I put my hand back down again. Not that I would ever do that, send us off topic or be obscure, but honestly, I think take Tommy's question instead. He's never obscure.
Thank you. Yes, there's so many, as in the last question, the depths that an answer can come back is quite enormous. Tommy, you indicated.
Yes, Chair. It's a comment more than a question. First of all, it was a really good presentation. I thoroughly enjoyed it. But what it highlighted was the diverse range of services that we have working with our partners, all of which have continued throughout the pandemic. I think the board should acknowledge this somehow, possibly in our council magazine, and thank all these staff who've actually stepped up to the mark, whether it be the health service staff, the police, schools staff, council staff, voluntary bodies such as VODA, YMCA, Age UK, Health Watch. I mean, the list could be miles long. But all of these people, and indeed a lot of members of the public who've come on board as volunteers to help, I think they should all be acknowledged. And it would be nice if we actually did something in the council magazine, which goes out right across the borough, so that people would actually see that the council actually cares about what these people have done. And I think this would go a long way in the publicity around things like the Health and Wellbeing Board. Thank you very much.
Thank you. I absolutely agree with those comments. Mike, is that you indicating to speak? MR.
It is, Chair. And it was just to draw your attention to a comment that Julia Charlton has put into the chat, because Julia, unfortunately, can't get a microphone to work, and she does pose a question. So if I could just pose the question on her behalf, I would like to ask, since Health Watch North Tyneside has a statutory function at this committee, the Board of Trustees would like to know if we could please have an update on the NHS White Paper. Things are different from a year ago when last considered at this meeting, and we would like to know the current thinking and future intentions on local voices and local decision making.
Thank you. I have read the white paper and note the changes in the system. Paul, that was specifically addressed to you. Do you want to take it up?
I don't. Chair, I don't think it was. I think it was Julia, our chair, asking if the board would have a future update about the ICS plans.
Sorry.
Rather than that's okay. Rather than directly asked to myself, because I don't know the answer, unfortunately. I wish I did.
Yeah.
Can I suggest Leslie Young Murphy answers the question, Chair?
Yes, Leslie.
Thanks, Margaret. And I can also see Claire Riley's hand up as well. I think it would be, given that the white paper hasn't long been out, and the whole system is digesting what that means, because there's a significant amount of partnership work and strategic discussions going on. I think it would be helpful if we brought something back once there was a bit more clarity in terms of what it's going to look like for our system. I don't know if you want to add anything, Claire.
Claire, you're muted. You're muted.
Sorry, Margaret.
All right.
I think there's possibly a double act between the Trust and the CCG, that when the time's right, we could maybe just give an update on exactly what the current position is.
That would be extremely useful. And actually, having read some notes on the white paper, the paper and some notes, I was going to suggest that as a future agenda item. Again, when the time is right. It looks quite vague at the moment. Right, thank you very much. Is there any other indication?
Chair, Scott Woodhouse. Could I suggest a triple act for that presentation? Because obviously the local authority from an adult social care perspective and public health to feed into that as well. Thank you.
So basically you'll have the same act that you've just had, Chair.
No, just as
with Claire keeping us right.
Right, thank you. Are there any other indication? I have no indication of any questions or comments. Yes, Leslie? Leslie?
Sorry, Chair, that was an old hand.
Right, is there anything else? Then I think that brings us quite naturally, quite neatly to the end of the meeting. And obviously the presentation this afternoon was to give us both ourselves, the joint Health and Wellbeing Board and the Adult Social Care Board Committee final sight of these intentions. Can I ask that we note these commissioning intentions and again congratulate the presentation and the ease of understanding of those intentions, and give our support to the work that is going to be undertaken over the course of the next year, and of course look forward to the same exercise this time, possibly next year, or when we're COVID free. Anyway, can I ask agreement that we note those intentions? Thank you.
Yes.
Lovely. Right, I think this is the last meeting of the municipal year. Thank you all very much for your attendances through the and support through the year. And obviously, I hope everyone has a freer Easter, maybe not quite as free for home, but we're heading there, folks. We're heading there, folks. And I think in saying that, I acknowledge that we're only partially through this whole experience, that we will be going on in a strange world for, I suspect, a lot more months now. But I think we've done very well. Incredibly proud of the vaccination reputation we have locally and nationally. I think we're noted everywhere. And well done to everyone involved, and I echo Tommy's thoughts that at a certain time, at a point in time, there needs to be a huge thank you made to all those who have helped us through this awful time. Thank you all very much, and I wish you well. Thank you. Bye-bye.